Okay, guys, I'm back on live. I am so sorry. I'm not sure what happened, but let me try to get Aimee back on. Let's see if she joins again. Bear with me. Not sure what happened. We're trying to do the do's and don'ts. Okay, there she is. I'm sorry. I don't know what the deal is.
Hi, I'm here.
I, I don't know. Okay, so let's recap. For those that I draw, I don't know if it's me. It might be me because our Wi-Fi here is a little wonky now. But we're talking about the do's and don'ts of IVF with Dr. Aimee Eyvazzedeh, the Egg Whisperer, which you can find her on social media. We're going to talk about first the social aspects of some of the social aspects regarding IVF cycle. The first thing I'd asked her that we abruptly got cut off was sex during IVF. So hit
Let's talk about sex, baby.
it.
But really, you're taking all these drugs that make you feel super horny, right? And it's totally unfair to tell a woman who's being pumped up with drugs that make her have lots of egg white vaginal, the egg white cervical mucus, and then say you're not allowed to have sex. I mean, that's just incredibly unfair. So I tell people, listen to your body. If you want to have sex, have sex. Orgasms are totally safe. But there comes a point where I use a phrase that maybe we heard of when we were like maybe in a senior in high school or maybe in college. It's called outer
Hmm.
course,
Yeah.
where you don't have vaginal penetration. You can definitely still orgasm, but talk to your doctor because every doctor's recommendations are going to be different. So
Hmm.
for me, I tell my patients, if you feel like you want sex, have sex. It's as simple as that. But leading up to the egg retrieval, we want the guy to ejaculate. I tell the guys here to ejaculate the night before their trigger shot. And I always talk
Okay.
about that so that I'm not getting a whole bunch of old sperm walking out with little canes on the day of the egg
Hmm.
retrieval.
Yeah, well,
But
makes sense. Yeah.
yeah, but sex, I say, is safe unless you're super, super bloated and very, very uncomfortable. And if you don't even want to have it, like you shouldn't feel like you need
Yeah.
to. But if you want to, it's okay.
Yeah, and again, I second that. I went through 5 cycles, so for me, it was really painful. So
Yeah.
vaginal penetration was not ideal just because it would hit
Right.
the cervix, which would hit my ovaries and would hurt. But there's
Hmm.
other things you can do without vaginal intercourse, as Dr. Advisor says. So
Yeah.
there, you can be a little creative, not too crazy, but you
Yeah.
can be creative.
Yep.
And again, if there's any question, always ask your doc.
And someone asked me, I mean, I think this is for people, babies after 35. No one is under the age of 18 here. I did have someone
Right.
ask me if they could have anal sex.
Hmm. Yeah, I mean,
And I said, I don't want to hear about it. No, thank you. Okay. So, yeah.
yeah. Okay, so next, let's talk about exercise.
Yeah.
So, what type can you exercise? What types of exercise are recommended, or should they be, restricted or not?
This is the thing. Doctors nowadays, we're super busy, right? I mean, we've always been busy, but people are busier than ever. So sometimes the easiest thing for a doctor to say is no, right? No exercise, right?
Mm-hmm.
Then they don't have to talk to you about what kind of exercise
Yeah.
you want to do, what's your regular routine. But my style is I don't want patients to think because there's this misunderstanding. It's a myth that as soon as you do IVF, you have to stop exercising. And then
Yeah.
what happens? You pump yourself full of these drugs, you get depressed, and then you gain weight
Mm-hmm.
because then you're feeling gross. So I tell people, please keep exercising. There's no reason to stop. And then they'll say things to me like, well, I read online. And I said, well, welcome to my office. You don't need to
Yeah, that's
Google
why
that.
I'm the
You just
doctor.
come
Yeah.
here.
Yeah.
Exactly.
Yeah.
So
Yeah.
exercise is also safe. I mean, I don't want you bouncing off the wall. Walking is great. I always tell patients, at your first stim check, around IVF treatment number 4 to 6, that's typically when I see people for the first time. I always tell them, I will tell you at that visit whether I need you to go down to low impact exercise or not. And for the most part, I tell most people at that visit, it's time for you to just walk. And
Mhm.
then usually around treatment day 8, treatment day 10, I say, why don't you just not even do that until after the egg retrieval? And then after the egg retrieval, they also feel like, I want to get back to the gym because I feel so bloated, right? So we have that
Mhm.
pressure to get our body
Mhm.
back right away. And I tell people, forget about it. After also listen to your body. And if you're feeling cramped and swollen, obviously walking is all you need to do. But if you feel like your body's back to normal, you can go back to your regular high intensity exercise.
So explain why you might recommend what the actual reason is why we might go down to low impact during the course of an IVF cycle.
Well, a cyst can rupture, an
Hmm.
ovary can twist. I mean, there are
Yeah.
medical complications that can come from an IVF cycle. We're talking about a 1% event.
Yeah.
But, the last thing I would want is for someone, I've had this happen before where a patient goes on a 5-mile high incline hike the day after her egg retrieval, and she's calling me about how much pain she's in. And I said to her, well, did you have that pain before you started the hike? And she's like, yes. I'm like, then why did you do it? Because obviously you just need to
Yeah.
be in bed sipping
Yeah.
on Gatorade all day. So it's like, don't think that, because we all want that bloating to go away right away. And people think if they exercise it off, it's going
Yeah.
to come off. And that's like the last thing you need. You just need
Yeah.
time, hydration, maybe a
Yeah.
poop,
Yeah.
and then a period.
Yeah. Yeah. So, I mean, there are, I think the best takeaway is listen to your body.
Right.
You know, you're going to experience feelings and pains and twinges and
Mm-hmm.
mucus and things that you've never experienced before
Mm-hmm.
because it's IVF.
Mm-hmm.
And, you know, and again, the internet's a great source of information. But honestly, and I did find this through the IVF cycle, and I'm an OBGYN,
Mm-hmm.
okay? The best source of my information for me to find a good answer was my doctor. That's what
Right.
I'm using them for. That's what I'm paying them for.
Right.
So why would I go and get into a chat, you know, it's not chat room or a group or whatever, and get
Right.
10 different opinions that just confused me more when I can get one from the person that I supposedly trust who's doing my IVF cycle.
Right.
So I do recommend that. That's the best place to find your information is
Right.
through the IVF clinic that you're using. And even if it's not directly from the doctor, the people that they work with, their ancillary staff, their nurses, anybody, they pretty much know how their doctors feel about certain things, and they can, within reason, answer for them. Would you agree?
I totally
Or the
agree.
doctors? Yeah.
And like, I have my own style, like after the transfer, right? But there's 6 other doctors we could have in the room. We all say something different to our patients, but that's just what works for me. And I know that it would work for my patients because that's just my style, and they come to me because they totally get me. I hope.
Right, I get it. And now let's talk about the travel during IVF.
So this is a funny story. I had a husband actually not realize that he needed to be there on the day of the egg retrieval. He was out of state, but he was close enough he could still get back on a plane. So guys, for you women out there who have male partners, we don't want them flying to another state. We need his sperm that day. Because a lot of people are like, that's one of the most commonly asked questions I get is, when do you need my husband's sperm? I'm like, on the same day as your, right? The same day.
Yeah. Mm-hmm.
So as far as traveling, you know, I have no problem in the first 4 days. And if you're a high producer, you know, you have a lot of follicles. You know, I like patients to be here at least 2 to 3 days before the egg retrieval. And I take care of a lot of egg donors, and these women have over 20 follicles. So they'll fly in, you know, 2-3 days before their egg retrieval and leave 2 days after their egg retrieval, but only after I know they're doing really, really well.
Yeah.
So the last thing I want is for someone to have, you know, a type of medical emergency, like a cyst rupture or something like that, and then I'm not there to help them, right? That would be so frustrating that they have to be seen in an emergency room somewhere, and I can't be there to guide.
And I will say this, I'm not saying this to scare anyone or to discourage it, but you have to be reasonable, because I've seen women come into ERs who have traveled, and the ER docs are not the best. A random ER in some place that doesn't even have fertility services who use them, they're not necessarily going to know what to do. So it's better that you just, you know, if you have a question, again, have a question about traveling, ask, because they might ask, how long are you going to be gone? Should you take off to Paris during this? Probably not. You know, you might have some questions, and they can just tell you what, and again, every specialist, every doc is different. They all have their little things that they like, and they're not always agreed on every little minute point, but you have to trust your doctor. At the end of the day, you have to trust your doctor, and that should be the person that gives you the information that you should follow.
Right.
I think that's,
and an ER that, especially where there's no fertility clinic nearby.
Yeah.
You've done the trigger shot, your pregnancy hormone will be positive, and they're going to be freaking out that you could be pregnant, and you just need some pain meds, you know?
Yeah.
Or you just need to be manually disimpacted because you're having a poop emergency.
Yeah. Okay. So next question. Even though none of us have really been able to do this recently, coloring the hair and getting the nails done.
I mean, my thing is, look, I mean, what's the rush? I always tell my patients, you look gorgeous to me. Just wait till the first trimester is over. That's just my style. I mean, honestly, could you do it? You could. But I would say if you're going to get your hair colored, do it before your transfer, and then wait at least until the second trimester. That's my thing. And the reason is, you go into a salon, there's so many, you know, when I walk into a salon, the salon that I go to, clearly I haven't been in like a really long time, but I think that's the case for all of us. I mean, I get a little bit of a headache, you know, just from all the chemicals that are in there. And I just think, well, if I'm getting a headache and if I were pregnant, then maybe that could affect my baby. That's how I think about it. So that's my rule. If you walk into the salon, you get a headache, you shouldn't be there when you're pregnant.
Well, I mean, I think to go along with that, there's not any real data there that says if you get your hair colored with this product, your baby's going to have birth defects or it's going to cause you to have a miscarriage. But what's even worse is you're going to think that, or you're going to be worried, and you're going to be stressed out about it, and which is just as bad. So just don't, if you're worried about it, just don't put yourself in that situation. That way you don't have to worry about it. I think that's the easiest way to think about it. Botox. Can we do Botox? Actually, I need some now, but can we?
So, yeah, me too. I mean, as far as Botox, it actually is safe. I mean, I'm going to say this out loud. It's safe in pregnancy. I mean, you could do it. But the thing is that we don't like to cause pregnant women pain. It's really like, it's frowned upon. Like, causing a pregnant woman pain could potentially have, you know, maybe some pregnancy implications. But in general, we just tell people you can't do it in pregnancy. During treatment, I tell patients, sure, you can do it. Like, Botox in your forehead is not going into your ovaries. So you can keep your beauty regimen as you're freezing your embryos. I'm not worried that Botox is affecting your egg quality. But after the transfer, no Botox.
Yeah. And I think that's safe too. And plus, it's going to be hard, actually, to find a doc who will do it. Just because if they're worried about you being pregnant, I don't know of any of my friends who do it would actually agree to it. So you're probably going to be limited in that way anyway.
The dermatologists that I know still did their Botox in pregnancy, but they did it for themselves because it's the same thing. No one's going to do it for them.
And then massages during your IVF cycle.
Yeah, I mean, there are a lot of great ways to deal with your stress during IVF, and massage is definitely one of them. But if I'm thinking about like being flat on my stomach for like an hour when my ovaries are huge, that just does not sound like a good idea. So if you want a massage, do it before stim start. Excuse me. Do it after your period starts, after the egg retrieval. Do it while you're preparing for your transfer. Just don't do it, you know, while your ovaries are. Yeah, totally.
Yeah. If it's hurting you, or, you know, or what I did is I just stayed on my back. And I did an amended massage. And, you know, but I think also, you know, it's also important to remember you got to stay hydrated. So you should do that anyway. If you're not even going through this, is make sure they always tell you to hydrate after massage. So if you're going through this, and you know, it's always better to hydrate before and after. And then for me, I only did it a few times, but I always laid on my back and didn't do the belly thing. So we'll talk about saunas, steam room, hot tubs, all of those things. What about all that?
Yeah. So for men, they should get out of the sauna, steam room, and hot tubs. No doubt about that. But for us, there's a reason why ovaries are in our bodies. Our bodies are warm, right? And so it does not hurt our eggs. You're not going to cook them by being in a hot tub, steam room, or sauna. But at the same time, we want you to stay hydrated, right?
Yes,
so during your IVF cycle, you're going to have the best physical recovery if you go in super hydrated, you know, whey protein shakes, electrolyte-rich fluids. You know, if you're spending an hour at night after a really strenuous workout in a sauna, that's really not going to be good for you. So just, you know, if that's something that you enjoy, 15 minutes in a sauna, no big deal. But just, you know, use common sense.
So why can't the men do it? Why is it not recommended for the men?
Because, I mean, just to say something, like, it just cooks their balls, right? I mean, that temperature shift, even 1 degree. So if a guy has a fever of like 101, you know, that can cause 2.5 months of sperm damage, right? Because the sperm life cycle is almost 3 months. So now you have to, like, it can literally wipe out sperm if he heats up his balls. I mean, right now it's, there have been some days in the last 2 weeks where it was almost over 100 degrees over here. And I was telling the guys here as they were, you know, waiting for their egg retrieval this weekend, I was like, grab some, this is not a joke, packs of peas and put them in your, you know, pants. Down there, put them in your pants, because I don't want fried sperm.
Right. We don't want, I mean, it makes sense, but it's good to know. It's good to know because, you know, and maybe this is another talk. We could talk about the do's and don'ts for men. Because, you know, it involves both people. And I guess rightfully so, we focus more on the woman, but there are things that the men might need to know. So maybe that could be another.
So I say, look, I say to my female patients, sit in the hot tub, soak, let your husband rub your shoulders, and you'll take sips of a wonderful margarita. And then as soon as you're pregnant, you switch.
Right. Then it's,
then
he gets to
do the
margarita,
right? And in the hot tub.
So while we're on it, what about alcohol and smoking?
So my thing is, it's really hard for people to stop at just what's considered one serving. One serving of alcohol is 4 ounces. That's very boring, right? I mean, I want people to have fun in life. I want people to drink if that's something that they like to do. But if you can't stop at one serving 4 times a week, right? I mean, then you probably shouldn't drink at all. But most people are finishing, if it's a couple, they're finishing a bottle of wine a night. Right. And that's pretty typical And that's not what I want people to do when they're trying to get pregnant. Why? Because alcohol is calories, carbohydrates, sugar. It can raise your hemoglobin A1C. It can have harmful effects on sperm. So we don't want that. So in moderation, totally safe. We don't want the sperm to be dizzy and drunk. We don't want the eggs to be drunk either.
Right. That's a good point. And then with the smoking, I know the answer to this one, but I just want you to
I mean,
say
as far as smoking,
it.
well, and back to the drinking, my patients who drink, you know, when you're on these hormones and you're shooting yourself up with these fertility shots, you're getting super tired, right? You're like in this fog. And I've had patients call me like, oh, shit, Aimee, I had a glass of wine last night and I fell asleep before I did my shot. And I'm like, ugh, you know, so that's another reason why
That's a good point.
because you're going to be more dehydrated and more tired. So
Right.
as far as cigarettes and vaping, like hell to the no. I'm just, I scare people and I'm saying, you know, I'm really sorry. This is a smoke-free clinic. If you smoke, you can't be my patient. It seems to work because people really do stop smoking. But for women, it can cause us to go into menopause a lot earlier if we're smoking. It just, and there's no recovery. It's not like if you stop today, your eggs are going to regenerate and be better. But, and for sperm, if a guy stops, they're lucky, their sperm will be better in 3 months.
Yeah. So, I mean, smoking is not good. I don't think there's going to be anybody that's going to tell you for any medical condition or treatment you're going through to, oh yeah, go smoke. Right. I think we're to say it now. Smoking's not good. Vaping's not good. We clearly know that. So,
if you want a smaller baby,
someone just asked about smoking marijuana or CBD oil.
Hell to the no also. No smoking marijuana and no CBD oil. CBD receptors are everywhere. They're in our fallopian tubes. They're in the lining of our uterus. It affects implantation. People don't realize that. Yeah. And I've had patients where I just can't get them pregnant. I'm like, what are you doing? And they're like, well, we use CBD every single night. And I'm like, you have to stop. Next transfer, it works. And it's like now I just, and this was years ago. So now I know enough from experience to ask everybody and say, no edible. You know,
nothing, no derivative of it. And I know there's a bunch of different ways women or people can do marijuana, THC, whatever. There's a bunch of different ways available, but you know, and just for what it's worth, you know, yes, it's natural in nature, but that doesn't mean that it's okay. I don't recommend it in pregnancy. I'm not going to recommend it after Dr. Aimee gets you pregnant. So, and she's not going to recommend it. And why is that? Am I just trying to be mean? Is she just trying to be mean? No, there's science behind it. So, I know people can get the cigarette smoking, but everybody wants to pause on the marijuana. But there's reasons why we advise that you guys not do it. So the answer for me is going to be no. The answer for her is going to be no.
Yes.
There you go. All right.
No.
Okay, so do you have any specific dietary recommendations? Like, should they be eating more of this, less of this? Is there certain supplements or anything like that you recommend women take during this time? Yeah,
I mean, the best diet, and I learned this from another fertility doctor. She said this once. I'm like, oh my God, that is such a good quote. It's the best diet is the one that you can follow, right? And obviously a diet that's filled with fresh fruits and vegetables, avoiding processed foods, like that's really important. But as far as like you have to be gluten-free, dairy-free, sugar-free, that kind of stuff I think is nonsense. I don't believe in that. You know, I just feel like everyone's body's different. We all have a different, we all react differently to different foods. So some people feel really bad, you know, having gluten, and other people feel fine on it. And it's not going to hurt your fertility unless you have celiac disease or a gluten sensitivity. So I think the internet plays this role into making us feel like if we had a piece of pizza that had gluten in it, we just destroyed all our chances of getting pregnant that month. And I've had people call me frantic thinking that that's true, and it's just not. So just a well-balanced diet. And if you have PCOS, a low glycemic diet. If you have endometriosis, consider an anti-inflammatory diet. You know, those are the kinds of things that I tell my patients to do. I want you to have a healthy BMI, exercise every day, make sure you're drinking water, sleeping well, and eating healthy.
Okay, good. So we're going to take a pause. I'm going to go back through and see if we can answer a few questions because there's a lot of them. Say, hold on. Bear with me. Okay. Okay, so I was going to ask this question later, but we'll answer it now. Bed rest post-transfer, and many say not to. Thoughts? Is it based on the individual?
Yeah, I mean, I know a lot of people just tell their patients, a lot of doctors just tell their patients, just get up right after the transfer and just go about your life as usual. If that patient's pregnancy test was negative 8 days later, whenever that doctor chooses to do the test, the first thing she's going to do is she's going to say, I caused that test not to be positive because I did too much. So I tell my patients something simple. I just say, take it easy. That's it. I sing to all my patients. I actually don't, but I just felt like singing right there.
Yeah.
But I just want people to take it easy the first couple of days after their transfer. No marathon running. This isn't the time to start preparing for your half marathon or your 5K. I give patients this, I tell people butt to bed, butt to chair, butt to couch, and rotate. And you can take a shower and go to the bathroom. You're not going to poop your baby out or your embryo out.
Right,
That's
right.
just my thing. A 2 days of taking it easy. That embryo is going to hatch and attach, stick and grow within 2 days. And then after that, low impact activity, no sex though, positive pregnancy test, then you can increase your activity and go back to what you're normally doing if your HCG level is reassuring.
Right, right. Okay. Good answer to that question. Let's see. How safe is it for me to transfer embryos in my 40s? Some doctors have seemed less supportive than others. Are there any statistics about harm to the baby because of an older mother? Let me see who this is. Need anything now? If you want to answer need anything now as to how old you were when the embryos were made, that might help a little bit. If you want to answer, but go ahead, you can take it. I don't know if you can see the questions there, but can you see them?
Yeah, I mean, it just depends on, I see the questions, but it just depends on where they were in the you know what I mean?
Yeah.
I just see the questions that come up right away. I'm not scrolling.
Yeah. So basically, again, how safe is it for me to transfer embryos in my 40s? Some doctors have seemed less supportive. Are there any stats about harm to the baby because of an older mom?
Yeah, I mean, pregnancy comes with risk, no matter what your age is. And for women over 40, the risks are a higher risk of preeclampsia, which is a hypertensive disorder in pregnancy that can really suck because you might have to deliver early to save your life and the baby's life. But there are things that we can do to prevent it. Like one of the things I do in trimester zeros, that's before a woman gets pregnant, is make sure her cholesterol is normal, especially her triglycerides before pregnancy. Make sure she has a healthy BMI, ideally under 30. Make sure her medical problems are very well controlled and treated. If she has pre-existing diabetes or hypertension, make sure we have treated that ahead of time. And then make sure she's seeing a high-risk OB once she's pregnant to manage her pregnancy very closely. And also aspirin seems to really, really help. So aspirin 81 milligrams, and some patients are given a higher dose by their doctors to prevent preeclampsia. But certainly there are risks with pregnancy. They are higher for women who are over 40, but the risks aren't so high that, in my humble opinion, a woman over 40 should not get pregnant or be scared out of it.
Yeah, so basically, as a maternal fetal medicine specialist, so I see a lot of the patients after Dr. Aimee has gotten them pregnant.
Yeah.
So, based on this question right in front of me, it depends on, for genetics reasons, it depends on the age of the embryos. Were you 34 or after 35 when you had these embryos made? So that will alter the genetic risk as far as having a baby with something like Down syndrome. But the one thing I want to, and I've said a lot about this recently on social media, and I've gotten a lot of crap about it. And people don't want to hear this, but it's true. Despite the health of the mom, no matter how healthy she is, being pregnant over age 40, you are at increased risk for certain complications in pregnancy. It does not matter how healthy you are.
Right.
It's called extremes of age. Okay. You're at increased risk for low birth weight, largely due to preterm labor and delivery. You're at increased risk for placenta previa, where the placenta is implanted over the opening of the cervix. Increased risk, as Dr. Aimee said, for hypertensive disorders of pregnancy, diabetes. Those are the main ones, and cesarean section. Okay. It is what it is. Okay. That doesn't mean you won't have a healthy pregnancy or you can't have a healthy pregnancy. It means we as the doctors have to be more cognizant of it and watch for it. And it is a risk that you can have. Now, if you have other medical conditions prior to getting pregnant at age 40, as Dr. Aimee said, it's much better to have them well controlled. Okay. Women with hypertension and diabetes can get pregnant, and they do, but their pregnancy is much better and easier to control and have better outcomes if those conditions are optimally controlled before pregnancy occurs. It's, as I always say, it's not the best time to play catch up on your medical health is not while you're pregnant. Okay. So doing it before you get pregnant is the best time to do it. So we'll just go on to the next question. Did you have anything you want to add to that?
No, I totally agree. 100%.
Okay. How common is IVF in older moms with the main purpose to test the embryos for health? I'm 38. We have 3 healthy kids. My husband is scared to have another baby at our age, and we briefly discussed IVF.
Yeah, I mean, I'm crazy like her. I have 4 kids. She has 3 and she wants a 4th. Join the club. I had my 4th at 40. I mean, I always ask people, what do you want? and what is it going to take to get it? And are you willing to do it? And if you're 38 years old and you want a fourth baby, that's fine. You can go do it. I don't know that it does. I'm not sure why this person needs IVF. Maybe it's an egg issue because
No,
she's
she was
34.
saying with the purpose to just test the embryos. She's concerned just doing IVF so they could genetically test the embryos.
Yeah, I mean, I think getting pregnant at home is a lot more fun, way more romantic. I think that there's this thought that somehow IVF babies are, because we're doing the testing, they're going to be healthier. So I am an IVF doctor, but I do everything I can to help teach people about their fertility so they can have the highest chance of pregnancy at home without my help. So, doing IVF is super common. Most of my patients are over the age of 39 and 95% of them do genetic testing. So it's super common.
Okay, yeah. Okay, one more question, then we'll go through what I have left here. Is there a certain weight or BMI you find ideal for implantation?
Yeah, I mean, I would say that some of the BMI studies say that if your BMI is over 30, you might be at higher risk of having a lower implantation rate. But for me, I don't think it's about the BMI. I think it's about other parameters like your A1C, your testosterone, your TSH, your vitamin D, your cholesterol. So when I have a patient who's a little curvier, I'm not going to shame her because of her body size. I'm going to say, what do we need to fix? And let's fix it. If it's your A1C, there's things that we can do. So, I mean, I'm not a big, you have to be this BMI in order for me to help you. I mean, obviously there are requirements in the operating room that we can't operate if a patient's over a certain body size. And I put my patients through.
The other thing is when on my end, having women pregnant at a higher BMI, especially over age 30, over a BMI over 35, and especially over 40, it's kind of similar as age. There are complications that can occur with the pregnancy based on your BMI, increased risk of diabetes, high blood pressure, cesarean section, other things. So, it can cause more complications and preterm delivery as well. So that is a factor, but it's something you should discuss with your doc to see if there's something you should optimize before trying to get pregnant, either naturally or through IVF. The other thing I wanted to bring, you had mentioned baby aspirin for preeclampsia prevention. That is something I actually did a video on, but just so you guys, if you guys want to learn about it, you look up baby aspirin for prevention of preeclampsia under ACOG, ACOG. It gives you a table. And that's what we use as obstetricians on who we recommend gets baby aspirin. And if you fall into those categories and you're not on baby aspirin, you might want to ask your doc. The ideal time to start it is around 12 weeks, but you could start it up to 20 weeks or so. You have that window. So you could Google that to see if you are a good candidate. I do not think everybody should be on baby aspirin. That is not something we just hand out with a prenatal vitamin. Okay, that's why that table's there. So, you can get access to it that way as well. Real quick, at 34, she's 34. Let's see, Tallulah Bell is 34. At what age do you recommend egg freezing? I'm not in a permanent relationship, and I'm afraid I'm getting too close to menopause to wait much longer.
Well, at 34, most women are not close to menopause. Menopause doesn't start until, the irregular periods usually doesn't start until we're in our 40s. But certainly there are about 10% of women, even in their 30s, who could have already run out of their healthy eggs. So getting your AMH level checked is step one, figuring out what it is. And then I have my golden rules that I share with people. If you're 32 years old and you think you want 2 kids, get your eggs frozen. So if you're 34 years old and you think you might want at least 1 kid, get your eggs frozen. Sounds like a great time to do it. You haven't run out of time.
Right. Yeah. And someone's saying that 34 is close to menopause now. I'm like, I'm 46. What does that mean for me? So no, 34 is not close to menopause. You still got time. And again, the best thing I say, it's not going to hurt anybody to have a consult with an RAI specialist. And the reason why I say that, as opposed to your general OBGYN, is that I'm not knocking general OBGYNs at all, but they're general OBGYNs. They're not specialists. And they can do so much as far as educating you about your fertility. They can do so much as far as seeing how fertile you are or whatever. But if you want to get your bang for your buck, the best thing to do is go to one of these guys, because this is what she does all day, every day. And if I were wanting to know, get a baseline assessment, what was going on or what I should do, or talk about family planning or what I should do, that's where I'm going to go. And again, I'm not knocking general OBGYNs because I was trained as one and so was she. But she's not going to tell you what to do for a high-risk pregnancy, and I'm not going to tell you what to do for your fertility. It is what it is. So if you're wanting to get a good assessment, go to someone like Dr. Aimee. You had mentioned briefly about AMH, and someone was talking to me about it. A colleague came to me, wife, AMH was really, really low. she's so distraught and terrified, and you, the last time we talked, you had this great thing you said about AMH. I want you to say it
Right.
again.
I'll say it again. Always mean hormone. Or the other thing I say is always meandering hormone. It's a very confusing hormone because you can get it 1 year, it could be 1.7, and the next year you can get it and it could be 0.6, and the next year you can get it, it could be 1.9. And then you're like, I don't know what to feel. And that's the thing. Like, it just kind of meanders over time. Our eggs don't go away overnight. They go away over time. And so age is the best predictor of pregnancy, right? And there's no such thing as being 35 years old with the eggs of a 45-year-old. There's just no such thing, right? And there's no such thing as a 45-year-old. I've had patients come in, I'm 45, and my doctor told me I had the eggs of a 21-year-old. I'm like, I'm sorry. There's just no such thing. I mean, you might look 21, but your ovaries still are 45 years old. So I think we just need to do a better job as doctors of educating women about this stuff and getting their AMH level checked at an early enough age. Because the other thing is, like, you can be 35 and say, well, I'm just going to wait until I'm 40 because I have 4 friends that all got pregnant at 40 without any help, right? And that just doesn't make sense either.
Yeah, and again, I've been talking about this, nonstop too. And I'm a prime example. I was 40 and a half when I started IVF. I'm an OBGYN and I knew more than the average patient. And I had no viable eggs. I had poor egg quality. I was healthy. I worked out all the time. I didn't have any medical conditions. I wasn't on any medications. I had a good body weight and I still couldn't get pregnant. So, you have to start the conversation early. You can never assume based on what your friends did, your mom did, your sister did, how they were when they had got pregnant naturally or not, because every individual is different. Fertility is not inherited, meaning if your mom was fertile myrtle at 45, it doesn't mean you're necessarily going to be, and you can't assume that that's the case. So having those conversations early and knowing the facts is what's going to be empowering, and know what the real information is out there. You can't then finally, and you might have something to add to this while we're on the topic. I hear a lot, we talked about this before, that many women say, well, if I can't get pregnant on my own, then I'll just use IVF. And IVF is not always a valid plan B. It doesn't get everybody pregnant. It did not work for me. I had to end up using an egg donor after 5 cycles and then an egg donor cycle. So what would you have to say about those people that say that?
I would
about
say
IVF.
So diagnosis before treatment, and do the treatment that's needed for your diagnosis. And so I hear, like, I tell patients, like, oh, your FSH is 17, your AMH is 0.3, you're 35 years old, we should do IVF. And they'll say, like, well, I really want to do 3 IUIs first. And I'm like, I will totally honor and respect that, but IVF is what we do now. IVF isn't what you do after 3 or 6 IUIs don't work. So I think it's really important to get a roadmap from a fertility doctor based on your fertility diagnostic test and what they say about you.
Right. Good. Great answer. Okay, let's go to, what about acupuncture and Chinese herbs to improve egg quality?
I mean, I joke and say, just stop taking the dirt. I mean, my patients are taking so many supplements and they come in with these unmarked bottles. And I'm like, what are you taking? But they quiz me about every single thing I'm giving them. And of course I tell them, I'm like, okay, so you're going to take something that smells like, you know what, tastes like, you know what, comes from God knows where, probably is poisoned with arsenic and lead, and you're not going to question them. I'm like, no. Obviously I have trusted herbalists and trusted acupuncturists that I work with, but depending on where stuff is sourced, you don't want to take it. Acupuncture, I think, is awesome. I think it's a great way to get through an IVF cycle and have less symptoms related to, like, nausea, vomiting. All these drugs make you feel sick to your stomach, the bloating, the pain associated with treatment. So that's why I always tell my patients to see an acupuncturist, especially in the first trimester when you're feeling the worst. They can really, really help. But as far as improving egg quality and stuff like that, I don't know. I mean, maybe in some people, but for the most part, I definitely ask patients to see an acupuncturist to help with all the side effects, like the physical symptoms of IVF. I think it really helps with that.
Well, for me, I didn't do acupuncture until my last, getting ready for my I had 2 donor egg implant retrievals, whatever. The first one failed. The second one took. And I took acupuncture with the last one. I think for me, I personally, I'm a maternal fetal medicine specialist. I'm not an REI, but I don't think it improves egg quality. I think it helped my stress.
Right.
And I think that there was something to
Mm-hmm.
be said for that. So from someone who went through 5 cycles and 2 donor egg cycles, I would say if someone asked me what's the one thing you would say, I honestly would say do acupuncture.
Right.
Because if anything, it's going to help with your stress level, which, you know, is actually one of the big players when you're going through IVF. You are stressed and you want it. I'm not telling anybody to not be stressed. You're going to be stressed. I get it. But to help minimize it and rein it in a little bit, that's what I think acupuncture is good for.
Totally. I want everyone to build their own mind-body center around them. You know,
Right.
build your team, get your therapist, join an online support group with the therapist, you know, figure all that stuff out ahead of time.
Right. So let's see. Are there any, when someone decides that they're going to do IVF, are there certain vitamins or things that they should just start taking to get things ready? I mean, obviously a prenatal vitamin is never going to hurt anybody. Anybody of reproductive age, I tell them just take a prenatal vitamin. So would there be anything else in addition to that?
Yeah, prenatal vitamin with fish oil, vitamin D, especially if your vitamin D level is low. CoQ10, I think, is one of the best things a woman can start even in her 20s until she's done having kids and maybe even beyond. I certainly have other things that I recommend on an individual basis. I mean, I don't want people just going online or reading a book and then taking all this stuff.
Yeah.
I mean, you hear about like royal jelly and maca and bee pollen, and it's like there's certain things that I think really help, and I individualize my supplement recommendations based on a patient's diagnosis, whether she has PCOS, endometriosis, or decreased ovarian reserve. It's not going to be the same regimen for everybody.
Right. And again, while we're talking about this, it's very important, and Dr. Aimee touched on this a little bit earlier. You have to let your doc know what you're taking. Everything that you're taking. Right. Because they need to know what they're dealing with. And like she said, and I see that even in pregnancy, women will take whatever they saw in some social media mom group for whatever thing in their pregnancy. But if I need to give them insulin or something for their diabetes, or recommend baby aspirin for, they question me. And I'm like, wait a minute, do I need to like be a mom group expert for you guys to trust me? So listen, one of the big messages from all this is you got to trust your doctor. You pick that doctor for a reason. And, you know, we're in the business of helping people. We would not be very successful or have a practice for very long if we were doing the opposite. So, you know, we want to just do the best job that we can for you. So you got to trust us. So when it comes to what you're taking into your body, as far as whatever you got at Whole Foods, whatever or whoever told you've got to let your doc know what you're taking. So let's talk about, like, if I get constipated, if I have a cold, what medications can I take while I'm in my IVF cycle?
Yeah, I mean, for constipation, I recommend not taking laxatives so much because it can cause such bad cramping. And when you're already cramping, you're not sure if it's cramping from a complication from the egg retrieval or cramping because you just took a whole bunch of senna. I recommend Colace. I ask my patients to start taking it a few days before the egg retrieval, especially if you're given Tylenol with codeine. If, let's say, you have over 15 follicles, that can also slow things down after an egg retrieval. So Colace is great. Milk with magnesia can also be used as well, and sometimes a glycerin suppository, depending on how bad things are. But there's a bowel regimen that I recommend to patients when they reach out to me if they're having problems. So that's my poop story. What was the other question?
Like if you had cold or if you're nauseated, just any kind of like,
So for a cold, I tell patients, and you know, during stim, I mean, you can just use anything, Claritin, Zyrtec, Benadryl. I'm not worried about that kind of stuff, even if it has a D in it, Claritin D. In pregnancy, it's a different story. You want to avoid anything that has the D, Claritin D, for example. Robitussin is safe. That's what I tell patients. Dayquil, NyQuil, no problem. But if you're also having a fever and you're really sick, it may not be the right time to cycle. So talk to your doctor right away, because especially if there's anesthesia concerns, the anesthesiologists really get annoyed if they're not prepared ahead of time that you're sick coming in, especially right now with COVID. People are hypersensitive about a cough right now is like an act of war. You know, you're like, oh my God, you're assaulting me by coughing.
Yeah. No, I mean, I think, you know, people, when they're getting ready to start their IVF, and when you have in your mind, my IVF is supposed to start mid-April.
Right.
But then something comes up and you have to postpone. it's so hard. And I find that sometimes patients may not tell exactly what's going on because they don't want that.
Right,
But listen, you're going through something major. You want to get the best yields you can, and
right.
you want to be as successful as you can. So if you're really sick or you have the flu or you're febrile, you got to let them know, because your
Right,
doctor will make the decision whether or not, we might need to put this on hold
right.
and wait a little bit longer. But it's the best thing for you, actually, so that your cycle
Hmm.
can be as optimal as possible.
Right, right.
And dental work done during an IVF cycle.
No problem. I mean, I don't
Yeah.
want you to get implants the morning before your egg
Yeah.
retrieval, ideally, especially if it's major cosmetic surgery that could cause bleeding in your mouth, because then again, the anesthesiologist will be pretty pissed off at me.
Yeah. Yeah. Let's talk about, when patients come in for IVF or talking about IVF and getting prepared, do you
Mhm.
recommend that they get counseling in any
Oh,
way?
totally. So that's the
Mhm.
T of team therapy. So I have a lot of therapists that I work with, and one does an online group for people going through IVF for people to
Mhm.
sign up for. It's 6 sessions. She also does one-on-one therapy, and I have about 3 that I adore in the Bay Area, and also several out of state for patients who are out of state as well. So I highly, highly recommend it. And one of them taught me you can be well and go through IVF.
Mhm.
But you have to have the support around you. You don't have to feel like a basket case. You don't have to feel like you're turning into a lunatic, because IVF can turn a sane person perfectly insane. It can turn
Yeah.
someone that's well extremely unwell and very depressed and anxious.
Yeah.
It can turn someone without OCD into someone with OCD.
Yep.
So
Mhm.
ideally, you have the support ahead of time. You go into it and it's a breeze. You don't want to finish it
Mhm.
and be like, now why the hell did I do that without any support?
Okay, I highly recommend it as well. I will be honest with you, I didn't do it, and I should have, because I think
Mm,
my experience, I don't think the outcome would have been different. I mean, my eggs were my age, but
right,
I think mentally and emotionally, it probably would have helped me a lot more.
right.
So that's probably the second thing. Acupuncture, get counseling throughout the process. And
Mm-hmm.
there's actually a lot available online now, not just because of COVID, but in general, there's a lot
Mm-hmm.
more available. I'm noticing about people going through infertility and IVF specifically, a
Right,
lot more resources out there. So I encourage you guys to look at that as well.
right.
So what we're going to do, I want you to touch briefly on what's going on with COVID and fertility treatments, and then we're going to go back to answer some more questions.
Yeah, I mean, Dr. Fauci was quoted, I think last night, saying a surge is not inevitable. And so that's really powerful for someone like that to say, because I've been scared and I'm trying to rush my patients through freeze your eggs, freeze your sperm, freeze your embryos, because October is coming, because the surge might come. And I hope that it doesn't. So right now, most clinics are open. And I know that some clinics just started opening. And certainly we have a new normal. And it's really important to talk to your clinic about what that new normal is, so you understand and you're not disappointed. If your support person can't be with you, you don't want to find out the day of your egg retrieval that your support person cannot be with you in the pre-op or post-op or at the transfer, and then be devastated, right?
Yeah.
And so, that we're just, life as usual. Life is our new usual.
Yeah, and I say that a lot too. It's our new
Yeah,
normal,
it
and it's
is.
not going to change anytime soon, nor
No, I
should
don't
it,
think it'll ever.
until
No.
we know what's going on. Because again, I stress, it's a first time for the general public. It's definitely a first time for us. I've never
Right.
been through anything like this in my
Mhm.
career as a medical professional. So we're learning right along with you guys.
Right.
What I do want to, while we're talking about COVID, and this is just for anything when it comes to medical anything, if you think you've been exposed, if you have symptoms, you
Hmm.
have to be honest about it.
Hmm.
Because if you're not, because you're afraid either Dr. Aimee can't see you that day or she might have to reschedule your appointment, it's not just for you. It's for all of her staff, all of my staff.
Yeah.
It's for everybody that's taking care of you, everybody you come in contact with. We have to do
Right.
our duty as people to make sure that we keep everybody around us as safe as possible. So yes, your
Right.
appointment might get postponed,
Right.
but it's just postponed. It's not
Yeah.
canceled forever.
Right.
So I just think it's important that no matter what we're doing as people who are non-medical, we just have to be honest when you're asked about your exposure and whether or not you have symptoms.
Right. And
I
we're
think
lucky
that's
here in
the best
here in
thing
the
we can
Bay
do.
here in the Bay Area, we have rapid testing clinics that
Yeah.
you self-referred, no doctor. I'm sure you do too. 20 minutes
Yep.
later, you get your
Mhm.
results. So it's
Yeah.
really nice.
It's really important.
Yeah.
Okay, so let's answer some more questions. Okay.
Okay.
What is the percentage of motility that is best when doing IVF? Would a low motility cause an abnormal embryo?
Yeah, I mean, every healthy embryo takes a healthy sperm cell and a healthy egg cell, but the sperm cell, we don't need a lot of motility. Sometimes even twitching sperm can turn into a beautiful embryo. But if the sperm quality is low, you want to know why, because there might be a genetic reason, and you don't want to learn the hard way that there was a genetic reason for the sperm abnormality and wish you had taken your time and learned a little bit more about the sperm first. But yes, low motility sperm, that's what ICSI was invented for. Go for it, but make sure you've seen a urologist. And I created something called BALLS method, BALLS method, for that very reason. So if you don't have someone talking to you about this stuff, you just go through that method and make sure that you've looked at all the letters and applied that to you. So go to ballsmethod.com.
Perfect. Okay, so Denise Lissette has a question, but a comment, but I'm not sure what, I'm kind of guessing where this is coming from. Basically, she's saying a fertility doc told me to not even waste my money and mental health for IVF. I have to use an egg donor. So is there ever anybody that would come sit across the table for you that you would say, you know what, I would not do IVF on you. I think we should go straight to egg donor.
52-year-old.
Yeah.
I mean, my thing is men can have babies when they're 45 and no one tells them you have to use a sperm donor. And even if a man was 65, we don't tell him you have to use a sperm donor. And if a man had just one sperm cell, we wouldn't tell him he has to use a sperm donor. So for women to be told that they have to use an egg donor when they still have eggs, I have a problem with that. I feel like a lot of women need IVF closure. And I don't think it's harmful for a woman to at least start a cycle and see what it would look like for her to get there in her own time. And I always tell patients, we may not get an egg today. We may not have a fertilized egg. We may not have a healthy embryo. Do you understand that we're going into this just for closure? And they're so happy to have that opportunity. And we already have their egg donor picked out, right? So we know that we have things in parallel, or we'll talk about it later. But I think that it can be harmful because what happens is they have the egg donor baby and never tried. 5 years later, even if they're 50 years old, you know what they're going to ask? They're going to ask, I wonder what would have happened. I wonder what would have happened if I had the opportunity to use my own egg. And I don't want people to do that.
Yeah, I mean, I think as long as you know, and the docs are very good about talking about the statistics about, you know, but I agree. I don't think anyone should ever, if they're willing to go through IVF, should be shut down unless there's a medical reason or something else, you know, just based on age alone. Right. You know, docs are very good about talking to you guys about that. And so I don't know your specific situation, Denise, but there's your answer.
She's 41 with a low AMH of 0.2. So for me, if you were in my practice, I mean, that's what I do. 41 AMH of 0.2, come on down. Let's see what we can do. But financially, if you had money set aside and you wanted to use that money for something that had an 85% chance of pregnancy, it makes sense to go right to egg donor, right? Yeah. But if you're like, I'm okay spending the money on something that would have a less than 5% chance or 5%, but you don't know if you got a good embryo, now you're in the 85% chance, you know? So you just
so that's a good point. So basically, if Denise, if you sat across and you knew that if you did IVF with your own, you know, based on the statistics and age, you know, you have a less than 5% chance of having a successful pregnancy with IVF using your own eggs versus an 85% chance of using whatever money or time and mental health you have to use egg donor. That's only a decision you can make. But what Dr. Aimee is saying is she wouldn't close the door on you. She would just tell you what the statistics are, and you make that decision. Because that's only a decision that you know each individual can make. Does IVF increase your chance for twins?
It does if you transfer 2 embryos, and it does. Very rarely you can get one embryo split into 2. It's about 1 in 400. Every clinic's monozygotic twinning rate will be different, so you just have to ask that clinic. But for the most part, the number of babies you can get from a transfer is directly related to the number of embryos you put into the uterus.
So are most, while we're on the topic, are most centers across the nation in the U.S. doing single embryo transfers? Is that what's recommended now?
Yes, I typically recommend a double embryo transfer if 2 single embryo transfers didn't work. That's the only time that I would do a double. Or we do a arm wrestling match, and usually I win because I'm pretty strong because I'm you know, working out all day with my ultrasound machine, and no one has won the match quite yet.
So just from my own personal experience, I put 2 embryos in, but that's because I had already had multiple failed transfers and my age. And I hear all the time, people, I want to do IVF because I want to get twins. Yeah. Yes, twins are very cute. But
yours are the cutest. Yours
are
and
mine are
cutest. I'm sorry.
Cute. But listen, twins are a high risk pregnancy, and they're high risk for a reason. And I almost lost my twins. Yeah. Okay, and you have to understand that there is a risk with twins. So you got to talk to your doctor about what's best for you. And I am an advocate for single embryo transfer, even though I had twins, because again, I almost lost them. So, and I would have been without any kids. Thankfully, it didn't work. It worked out for me, but you know, just I would never, and this is just me, and you don't have to even comment on this. I would never go into IVF for the explicit purpose of trying to have twins. I don't think that's what IVF is for. I mean, am I out of line here?
No, I think that's the
Yeah,
standard of care now.
yeah,
You
yeah.
know, I have patients that come in saying they want twins, and then I have an article I have them read. It's written by a
Good,
woman
good.
who said, I regret IVF. And her story is that she has twins and one has lots of issues, and she
Hmm.
wished that someone had told her that that could happen, and she didn't feel like she
Hmm.
was counseled well enough. And then I have a patient who had twins that were born at 25 weeks, and I say,
Hmm.
if you still want, you have to talk to her. And
Yeah.
so I've never
Or
had a
talk to
patient.
me.
Yeah.
Yeah. I mean, I delivered at 31 weeks and
Yeah.
I almost lost, it was every day from 22 into 30 weeks when I was in hospital on bed rest.
Right.
I worried every single day if I was going to have to make the decision if I wanted to try to resuscitate the, I know this is getting off topic, but but it's a
Right.
real thing.
It's real.
It's not easy. So the whole twin thing, but just make sure you have a real heart to heart discussion
Right.
with your doc and
Right.
listen to them.
Yeah.
Let's see. Everybody wants to talk about AMH. We're going to have to do a discussion just on AMH because every
We
question.
can.
We can. Okay. Preferring to have black people with more kids need to be honest. Yeah. So let's. We're gonna use about 2 to 3 more minutes. Let's talk about specifically over age 40. Probably is that which age group you would say are using more donor eggs?
Yeah, I mean, I'm seeing more women over the age of 45 than ever before. I'm helping women 50 to 55 now get pregnant. And obviously, we're all using donated eggs. So I think it's a beautiful way to grow your family. And we're seeing more and more of it because more women are delaying childbearing at a time where they're out of healthy eggs.
Yeah, so why I'm bringing this up is that I see on social media, I've been very transparent and
Mm-hmm.
it wasn't easy. I mean, I've gotten a lot of negativity, but
Mm-hmm.
the positive far outweighs that based on what people's opinions are of women my age getting pregnant and
Right.
then using donor eggs. And it's fine.
Right.
I did that
Right.
to educate and be transparent to help
Mm-hmm.
other women like myself.
Right. Right.
But then I also see this group of people who get really, really irritated with women who
Right.
got pregnant at 45, 46 and act like they just had IVF and didn't use donor eggs. I want to say it's up to her
Yeah.
whether or not she wants to tell people. That is a very, very, very personal decision
Mm-hmm.
that's related to her family. And
Mm-hmm.
I want to tell women to just back off just a little bit.
Right.
I wish in an age of social media, I think what it is, and you can expand on this, I think everybody's expecting everybody to be transparent.
Right.
And they don't have to be. I
They
mean, would
can't.
you be transparent about something else in your family and then expect another person, if you decided not to be transparent about whatever issue in your family, but you expect a woman to be transparent that she used donor eggs, I don't think that's quite fair.
Right.
So there are some of us who are transparent about it, and that's fine just to educate. But I do firmly
Right.
stand behind those who choose not to.
Right.
And I get it. What
Right.
do you think?
Yeah, I mean, I tell people every pregnancy is natural. As soon as
Yeah.
I put that embryo in the uterus, it's nature that's taken over. I'm not doing anything. There's no such thing as embryo glue, unlike the company that makes it. There's just no such thing. And every egg is yours because you paid a lot of money for that egg.
Right. Yeah.
So those are your eggs. As soon as there's a reason why you chose that egg donor. And once you have them, those are yours. And it's no one's business where your pregnancy came from. It's natural. Anyone asks you, is this your egg? You say, damn right it is, because it is your egg.
Yeah. And I mean,
So,
for me, honestly, I have written about it and I've spilled my guts about it all over social media. But if
right,
I'm out at the park and
right,
someone says, oh, your twins are beautiful, I don't say, well, I had donor eggs. I mean, no, I'm not going to do that.
right,
That's not how it
right,
works. If I get to know people and we get
right,
to that part of the discussion, then I have no problem talking about it. But there's been plenty of people I
right,
didn't divulge that information to because it was not appropriate. And trust me, my husband's
right,
African American. I have red hair. My twins have blonde curly hair, and we get some looks. Okay,
right. I
but
mean, I guess the question I would ask people is, why does it matter?
yeah,
Why
yeah,
does it matter? These are precious children, and
yeah.
I just don't understand that part.
Yeah, well, I mean, it's fine.
Yeah,
I get it. And for those that I feel, that can either handle the conversation or that I'm, gotten to that point with, I have no problem discussing it, but not
right,
for just anybody I meet. It's not a discussion I have.
right.
Are there
Exactly.
anything else? Because I want to stop it here and
Okay.
I'm going to scroll through. Go ahead. And anything else you want to add that we have not talked about?
Not really. I mean, I just love what you're doing. I adore you and how I love your TikToks and all the education that you're providing for people all over. So keep it up. That's it.
Thank you so much. And of course,
You're
you know I
welcome.
love you because I ask you to help me out all the time here.
Anytime.
So go find Dr. Aimee on anything Egg Whisper, the Egg Whisper Show on YouTube, Egg Whisper on Instagram. And let's see, I'm going to pick somebody. I'm just going to scroll through.
And
Tallulah Bell.
and if you want, we can do a giveaway of an Egg Whisperer shirt too.
Oh, okay.
Egg Whisperer shirts, if you want to do another giveaway too.
Let's see, Tallulah Bell, I'm going to declare you the winner of the Egg Whisper fertility pants. So Tallulah Bell, if you're on here, let me write you down in case you're not, you bounced, Tallulah Bell. And so just private message me on Babies After 35 to claim your IVF pants. And then what were you saying about the shirts?
Do you want to give away 2-3 shirts?
Yeah.
Okay.
You want to scroll through? Let's see. We're gonna do Marianne K23 for a shirt.
As long as you live in the U.S., don't make me send them overseas.
Marianne K23. If you hear this, you're gonna get an IVF shirt, and I'll post it after it. Let's see, Denise Lisette, we're going to do a shirt. Lisette. And then we'll get one more.
And then soon I'll have Tushy Method cups.
Oh, wow. Cool. Let's do, who else do I have here? Hey, Miss Hyde is another shirt winner. Hey, Miss Hyde.
Yes, Denise,
Got
I
it.
do.
Okay. So anyway, thank you so much. I'm going to end this so I can save it because we're hitting the hour mark. And again, thank you so much for your time. Have a great rest of your weekend.
Bye.
And wish me luck with my face issue because see you later.
See you later. Bye, love.
Bye.
Thanks for everything. Bye-bye.
Bye.